Today, again, we have some very exciting news. I think that we've had a hard time keeping a lid on it, but I'm not going to spoil the fun. I'm going to leave that for Georgia. We have 3 presenters today, actually. 2 of our local physicians, truly local boys made good. Folks who grew up in this area and have now returned to Allegiance Health to dedicate their lives to making sure that we all have the very best of care. Dr. Jon Lake and Dr. Mark Smith. Dr. Lake is in private practice, and Dr. Mark Smith is the emergency room medical director. But to get things started, I'll ask Georgia Fojtasek, our president and CEO, to come up and get us off to a good start.
Thank you, Chad. It's just a delight to be here. This is a great morning walking in here. And I think that this is a continuation of very positive news for Jackson, starting last Friday. And as I talked to John Russell at Consumers Energy yesterday, I see enormous synergies in what we're doing and what Consumers Energy is doing. We picked our title to reflect the fact that not only are we continuing to elevate the clinical care that we provide and the health services that we provide to the community, but to underscore our understanding of the economic difficulties that the community has experienced over many, many years, even absent this last recession, and how Allegiance can contribute to a spirit of hope and optimism. We've been very deliberate in the investments that we've made, and as I've shared with you over the last few years, we've been specifically deliberate about our role in leading through this past recession. We, at 85% female employment, and the fact that unemployment affected the male population much more significantly, became very aware that we were, in many cases, the only employer that a family had. And so we used our resources, we used our reserves to keep our staff intact and actually have had no layoffs over this period of economic difficulty. At the same time, we've continued growing, and our jobs have come in small chunks that weren't necessarily front page newsworthy, but we have continued to grow and have continued to add jobs and programs. The punctuation mark that we're putting on today is because of the order of magnitude of the services that we are announcing today. When I was thinking about this last night and after my conversation with John Russell, one of the things that struck me is that W.A. Foote, the namesake for our hospital that opened in 1918, was also one of the founders of Consumers Energy. The display at on W.A. Foote at the Ella celebrating CMS's 125th anniversary, to me, is real thought-provoking relative to what we're talking about today. And Foote told the members of the City Council that there's no reason why this city should lag behind other great and growing cities in the state. And that was in the late 1800s. I think Jackson was, when I looked at that exhibit and other exhibits at the Ella, I saw a very thriving economy, a very thriving Jackson. Some things happened, perhaps we weren't aware of the changes in the economic forces. When I think now about what has been happening with our local colleges, with the health system, and now with Consumers, opportunity to really revitalize downtown Jackson, I think that we can think about what W.A. Foote had to say. From a macro perspective about Allegiance, what you're going to hear about is a continuing investment in our development as a regional health system. This has been a series of building blocks, very deliberate over a number of years. The first thing that we knew we needed to do, and you've seen our strategic pillars, is to have customer-driven excellence at our core, so that we would earn and deserve the people who choose to purchase their health care from Allegiance. And by customer-driven excellence, we mean that we are tops from quality, safety, and service perspective. And until we knew we could demonstrate that and continue to show that as a very positive direction, now we've been able to tell you about our national recognitions, then we didn't feel like we could expand as much as we wanted to and envision for the future. That time has come, and we added our cardiac surgery services in 2008. These programs are on an even more significant scale in terms of impact for the health system and for the community. I wanted to speak just briefly about these programs from my perspective, and then Dr. Smith and Lake will give you more detail, and I think we're sending or have at your places fact sheets with more detail that Chad and our team prepared. First of all, it's easy with graduate medical education and 150 medical residents living in Jackson when it's fully functional to focus on that. Trauma isn't quite as sexy unless you're a trauma victim. And the chances are some of us in this room will be. It's my announcement to pay attention to our Dr. Smith. I'm amazed as we got into looking at trauma, I was approaching it perhaps from a business perspective without fully understanding the impact. Because what we've discovered in looking at what we wanted to do, what we needed to do, is falls off ladders, slips off boat docks, can result in life-threatening injuries. It's not all gunshot wounds and stabbings and motor vehicle accidents. There are just other slips and falls where immediate emergency treatment is needed. So I don't want the seeming economic impact of graduate medical education to overshadow our trauma message. And the issue with trauma is also economic growth because of years of productive life. And that's very demonstrable, and that's what Dr. Smith will be talking about. Relative to graduate medical education, there's a business development component to this. What really excites me is the opportunity to have 140 to 150 physicians who are experiencing their specialty education be in a community hospital setting that is mission values and vision driven, and to be able to be part of that next generation of physicians in a place that is team-based culture, very focused on quality and safety and not on doing stuff to people, but actually having the patients at the core of what we do. And those are the people that we will be inviting here and being able to be a part of having a supply of physicians, not only in Jackson, but in this region. And it's just a very, very exciting step for us and for the community. So with that as background and thinking about WA Foot's invitation to the city, I'd like to introduce Mark Smith to you. I think he's been here before, so Mark, if you can come up and join me. Mark, as Chad said, is Jackson native. I couldn't go without saying Mark's mom is here. She's one of our volunteers, and she is kind of his handler.
That's right.
And Mark, we're just delighted to have you here. Thank you.
Thank you, Georgia. I appreciate it. Good morning, everyone. My name again, Dr. Mark Smith. I'm medical director of the emergency department at Allegiance Health. I grew up here in Jackson, like Georgia said, and came back in October of 2008 to help manage the emergency department and bring us to a different level of care there. I am thrilled this morning to bring to you an announcement that we at Allegiance are seeking verification through the American College of Surgeons to be a level 2 trauma center. What that means basically is that trauma which we see every day in the emergency department. We take care of these people every day, but we don't always manage them in our department on a long-term basis. So trauma is a big deal. A lot of people are injured every year, nationally and even locally. It's the first leading cause of death between the ages of 1 and 44 years. Young people do stupid things, and they get themselves in trouble, and they injure themselves. We need to be a place where they can come and get good quality care. Fourth leading cause of death for all ages in the U.S. And even locally, 5,000 or so Michigan residents die each year secondary to injury. The state realized this some time back, and they wanted to develop a trauma network, basically. This was a law approximately 2004 that was put into place but was never funded. And so it never really went anywhere, didn't get any traction until just recently it became funded. And so what that meant was that since Allegiance was geographically in an area that was sort of isolated and had its own county around it, most patients that were injured just came here due to geography. There was no reason to take them anywhere else. Well, now that the law is being funded and the network is being set up, the state is basically mandating that we put in basically protocols for EMS, emergency medical ambulance systems, to take patients who are injured to the most appropriate trauma center. If you are a trauma center. If you're not, you will be bypassed and you will go to the most appropriate center. Again, mortality, as you've seen maybe this before, unintentional injury, these rates are pretty high in locally, Jackson County. So we've realized that we need to focus on this as well, because this is a big deal. Much like cancer and heart disease, unintentional injury is a big thing here locally. Also, you can see here that these numbers here, the little black dots, are the trauma centers currently. So Toledo, Ann Arbor, Bronson Borges over here. We are right here in Jackson. We are not a trauma center currently, but we will be. And this purple shading is basically an hour away from those trauma centers. In trauma, the mantra is if you can get someone to a trauma center within an hour, their mortality is decreased by 25%. So we want to be close to our injuries and be able to take care of people. As you can see here, there's a big gap here. So this being a trauma center now in Jackson, Allegiance Health, will cover this whole area here and actually be able to gain patients from other smaller hospitals that might not be able to take care of their trauma there. And so strategically and geographically, it's a perfect situation. Some of the benefits. This is a big deal for me personally because I have family members that were injured, was life flighted to the U of M and had delayed care and ended up with a disability. So this is a big thing. The golden hour is key. You need to have a place to go and stabilize patients and then admit, take care of them, be close to their family members. These are all big things in the care of trauma patients and how they recover from their injuries. Right now, we take care of patients who are injured. We still do that. We've done that all along. That's not changing. But what is changing is that we can manage the patients in the emergency department, admit them to our own hospital, have trauma surgeons and critical care physicians that are available to take care of those patients in-house, be close to the family members, out to rehab, out to disposition them out into the community and back into productive care. And that's being locally now. We're going to take that and bring it back home. If we weren't going to do anything, in other words, if the state trauma system was going to be set up and we didn't want to be verified and go through all this work to do this, we would be bypassed. Oops. We would be bypassed. Can you go back one, Joe? There we go. We would be bypassed down here at the bottom. For instance, if you were in a major car accident right on Michigan Avenue, right out front of the hospital, bad enough where you had to call a helicopter, and we weren't a trauma center, you would not come to Allegiance. You would go to the most appropriate, closest center. And so these are, patients that would go out of our community, and that would be a bad thing. We want to keep patients here. Some of the things that are going to be different, like I said, we take care of patients now, but the trauma team mentality is going to be a service that we don't currently have that will manage the entire patient from the emergency department injury all the way through to their care at the end and when they discharge them from the hospital. It'll be members of surgery, critical care, anesthesia, radiology, laboratory, all the people coming together to manage that trauma patient in the ER acutely within minutes of an activation. And then as needed, we will add services, and that will be managed by the trauma service. We don't have a trauma service now. We have surgeons, we have orthopedic surgeons and neurosurgeons and everybody to take care of those patients, but the management of all of that together and coordination and consistent protocol-driven care is not there. So this will give us the backdrop and the ability to do this. The magnitude of this is much like Georgia said on open heart type program. It's going to affect all services of the hospital and the community. You know, our EMS providers are going to all be educated and all be elevated to a different level in the protocols that are going to need to be followed. We will have what they call a trauma registry, which is a data gathering system that we can use later on to focus on injury prevention in the community, focused injury prevention. So if Jackson has, like Georgia said, a lot of falls off docks because we have really nice lakes, we're going to focus on those types of injury patterns and go back out in the community and teach people how not to fall off their dock. Texting and driving, home safety, things like this that are targeted to the local community. So this will be a big thing in the future. We'll have doctors, physicians, nurses, and members of our trauma team coming out to your schools, to your communities to help teach and educate people. And with that, I would like to pass this back over to Georgia to introduce my colleague, Dr. Lake. Thank you.
While we're doing the mic switch between Dr. Smith and Dr. Lake, let me just say that Mark and John will be here to answer specific questions. We kept this at a pretty high level that may stimulate a lot of questions about the specifics of the programs. And also, as Chad said, we'll have the details online for you all and more information coming out. So John, are you ready and wired?
Yes.
Great. So I'd like to introduce to you Dr. Jon Lake. John is a member of Townsend Allegiance Health, Townsend Medical Office, a family physician in Jackson. John, thank you.
Thank you. But I am talking about something that I care very deeply about, and that's graduate medical education. It's something I've wanted since I've come back to town. Some of you may or may not know that I did my training at U of M. I did some of my rotations here. My colleagues were jealous of the experiences that I had here, the exposure to the illnesses I had, the pathology, which is much more involved than most people think. Thank you. So what this medical education, what it's all about, it's the specialization. We've all go through, next slide, 4 years of college. We all go through 4 years of medical school, and then we pick the specialty of what we want to do. That specialty time ranges from 3 to 5 years. My training was 3, some of the surgeons are 5. Then you can do a fellowship, which will take you even further on from there. And then you get into your private practice or group practice, and then the learning process, as everyone knows, continues on from that point. Why GME in Jackson? There's a national shortage of physicians. I think everyone knows that. There's a lot of physicians that graduate in the state that move from this state for better opportunities because of what Jackson's economic forecast is right now. This provides a pipeline of physicians to stay here in town. The average is about 20% of the trained physicians will stay in the locale of what they train, which would bring us some quality to physicians to make up for what we're going to need in shortages to come. It improves quality of care. To Mark's point with trauma, we're going to have residents walking around the hospital. These are trained medical professionals that are going to be looking at patients 24/7. If there's a question, they can get there, they can get to the physician in charge, and give them much more approved opinion as to what's going on with that patient. It improves quality because we will be partnering with a lot of different institutions, which will open up opportunities for patients to be seen by physicians in their training. And of course, it's going to increase patient satisfaction. Something that's unique to our state right now that maybe you aren't aware of is the amount of medical training that's going to be increasing in this state. You know, Michigan, you know both schools at Michigan State. Central Michigan is opening a school. Western is going to be opening a school. Beaumont is opening a school. These physicians are going to need residency slots. They're going to need training in the specialty that they want, and they will come here as med students in some cases, see what we have to offer, and we'll be bringing these students to ours to get into our residency program for the next 3 to 5. Again, 20% of those people will stay here in Jackson. Proposed residencies. Family medicine as what I practice, internal medicine, emergency medicine, general surgery, psychiatry, obstetrics, and a transition year. The transition year, some people don't understand this for some of the different specialties, ophthalmology, dermatology, where residents are expected to do 1 year in the hospital for hospital training before they go on to their subspecialties. Partnerships, I mentioned one already, the Center of Family Health, which is a definite plus. I hope people have gone down and seen this facility. This facility is very nice compared to other facilities I've been involved with in my training, both in Detroit as well as Ann Arbor. We're going to have partnerships with Jackson Community College. We're doing this partnership with Michigan State, private physicians here in town, as well as their clinics. The other partners that you can see here are the other medical schools who will be wanting to send medical students to us, and it'll give us a chance to showcase Jackson. The impact of this goes far beyond medicine in my life. Again, I'm from Jackson. I love this town. The impact is going to, I think it's going to give a different feel to this town. This town has been an industrial town. This town has been a prison town. I think this is going to turn our town into a professional town. You're going to have a lot of students walking around. They're going to have white coats. These students are going to be in our educational facilities. Myself, when I was in my training, would go into high schools, talk about STDs, talk about many things that at residents who are a little bit younger than I am, which I think students will be able to relate to and take the message home, and we'll have them saturated, so I think we can make a real difference in this community. You're going to have these students walking around downtown. They're going to want restaurants. They're going to want coffee houses. They're going to need clothes. They're going to need many things this town has not needed in a long time. They're going to need places to live. I can't see any negative to any of this. They'll be wanting to talk. They'll want to talk to anybody who'll listen to them because they got all this information. They think they know everything. But I think the hospital is going to benefit in so many ways. I've mentioned increased care, access to care, and the town is going to benefit just from having 150 highly trained individuals that are going to look at our town and say, I like it here. People that are not from our town are going to go, what did Jackson do? I have this vision. I'm from up north. I just found out that someone else is from the Leland area. Travers went through a transition where it ended up being a ghost town. I don't know if anybody remembers this. And they kept trying the same thing. It didn't work. They reinvented themselves, and I think this will reinvent Jackson. Thank you.
Do you want to do that part?
Yeah, because my mic's still on.
Oh no.
Jealous. Total economic impact. This is from a survey. It's called Implant Software. It's run through the University of Michigan as to what in dollars and cents this means to our community. And that number is true. $21 million. That's in salaries, that's in taxes, that's in restaurants, that's in clothes, that's in transportation. That's a total package of what this program's impact will have on us. So my call to everyone in this room is we need that support. We need to let these people know that we want them, and we will make an unbelievable community program. Now I'm done.
Before we open it up to questions, let me, Mark's and John's comments made me think about some other perspectives to share with you and build on. First of all, as I thought, John and I have had conversations about becoming a professional town compared to a prison town, and I think that that's a good catchphrase. The concern is, I don't think we should be ashamed of having a prison here. It was part of our roots. It's part of who we are. It's safe here. When I was moving here, people cautioned me about that as a risk. I haven't felt that risk, and we've had a secure unit at the hospital for nearly 20 years and have had no incidents. In fact, it's a highly sought after place for our nurses to practice. The other thing, in particularly my experience with the Enterprise Group, is for those of you who are manufacturers here, I have the deepest respect for you. You are professionals and you are transforming yourselves, and the level of collaboration and sharing that I see and I experience just is very impressive. And so I think that we can continue elevating also the level of manufacturing. People value what comes out of Jackson. We've been bringing a number of people here who are from outside as we embark on these programs, and people are very surprised at what they see at Jackson and what they see at Allegiance. I think they're expecting very different, very small, much less sophisticated. So there's a lot of opportunity in continuing to show more people about Jackson. John mentioned, Mark Smith and John both talked to the level of disease pathology here. I want to put that in context because one of the slides you'll have is our ongoing comparison of Jackson's health on the public health data compared to the state of Michigan. Honest to Pete, physicians who come here talk to me about how exciting it is to practice because we're so sick. You all pay for that. Our responsibility, we know, is to be a catalyst working with the county and the United Way to change that effectively if we're really good at what we do, putting ourselves out of business other than slips on docks, which couldn't have anything to do with beer, right? I also want to introduce to you two new people who have joined our organization as a result of these services. Madonna Walters is a registered nurse. Madonna is going to be the administrative director working with Dr. Smith for trauma. Madonna comes to us having been the director at St. Joe's in Ann Arbor. She felt she had one more startup in her career, and what drew her to Allegiance was our commitment to the community. We're glad to have you, Madonna. Pam Royston is the administrative leader and will be the partner for Dr. Lake and others for the graduate medical education program. Pam came through Michigan, was last in Washington State, and has returned to Michigan, is living here. And a piece of what Pam has told me is that the mission, vision, and values of Allegiance are going to be great in terms of this next generation of physicians. Just a little bit about investments that may be coming to your mind. Trauma, because we already do trauma, isn't going to require a lot of investment in equipment, etc. We have pretty much what we need, some stuff we need. We will be and are in the process of recruiting a trauma surgeon to our health system and our community. Oh, there's a little spider here, join me. Not a black widow. Okay, graduate medical education. We're going to have to expand our teaching facilities. We've sorely needed to do that anyway, so we're going to be expanding, and we've already started some of the space shifts to add sufficient classroom space. We're going to be relocating some of our services downtown to Jackson Square to accommodate space for these residents. And then the Center for Family Health is going to be one of our key teaching partners, because the idea is that physicians will be able to experience patients in primary care all the way through hospitalization and back. It's called continuation of care. And so the center right now is evaluating all of what it needs to do, including additional parking space, etc. So our partners there will also experience expansion.